Can you no longer feel the sand under your feet? Do you suffer with numbness, tingling, burning, trouble sleeping, or stabbing pain? Have you been diagnosed with neuropathy and told you have to live with it and take gabapentin, Lyrica, Cymbalta, or injections with nasty side effects? Are you having balance problems or have fear of losing your independence? Your feet are telling you that they cannot survive with a lack of oxygen, nutrients, and blood supply. Is it a good idea to continue covering up those symptoms with drugs? I'm Dr. Rob Davis, DC of Active Health, and the author of the new #1 release book on Amazon, Breaking the Cycle: How to Take Control of Your Health When Traditional Medicine Has Failed. Our drug-free neuropathy protocols have over a 90% success rate for those that qualify. Call me, Dr. Rob Davis, at Active Health, 239-482-8686. For an appointment, 239-482-8686. Easy number to remember, 482-8686. Peripheral neuropathy is one of the most common chronic conditions in the United States. Today, about 8% of the United States population suffers from peripheral neuropathy, which is about 24 million people and growing. Peripheral neuropathy can happen at any age, but it's most common in older people. We've seen patients who have neuropathy who are from age 30 to 101. The most common cause of peripheral neuropathy is diabetes and also idiopathic, which means the cause is unknown. But we can treat neuropathy that comes from many different causes. The peripheral nerves are anything outside of the central nervous system, which is just the brain and spinal cord. So the peripheral nerves, like the ones that go down your hands and feet, are the ones that are affected in neuropathy. Statistically, 90% of neuropathy sufferers are relying on medication or injections for their neuropathy. But we all know those are not the ideal long-term solutions. Hi, this is Dr. Robert Davis with Active Health Neuropathy Solutions, and I am here with Joe, and Joe was kind enough to come on with us to tell us about his experience in the office. So Joe, if you could just tell us a little bit about why you looked for our office, the problems you were having. You found our office, you came in, we did an exam, and a little bit about the treatments and protocols and just your experience, how things have improved for you.
Absolutely. When I first came in, I want to thank the great staff Dr. Davis had. Unbelievable, very comfortable feel in here, no pressure at all. They make you feel really good. The direction they gave me was good. Just as long as you follow it, you'll get results. I was very skeptical. I was just figuring this is a nut I've been doing for years, trying to find a solution to my neuropathy. Boy, it was horrible. Needles, pins, burning sensation, the worst ever. I just gave up and just kept trying. This was probably my last resort here. And in a couple of weeks, all of a sudden, then the change started. Boy, the burning stopped, and needles and pins stopped. Now just a little numbness I have, but the direction it's going, never have I ever been feeling so good. Energy levels are up. You just get a great feel from when you start to heal with anything you have, especially after having 7 years of this I've had. And it's just tremendous what Dr. Davis has done for me.
With Linda, and Linda is back from a hiatus. You were up north for a while.
Cincinnati.
And you came in here, I would say 5-6 months ago.
I was here mid-January to the end of February, 6 weeks.
And your main, let's just go through it like this. Your main complaint back then was the knee pain, but you had a few other things going on.
Well, I came because I saw the commercial on television about neuropathy. And my father had neuropathy, and I have neuropathy. But when I came here and had the interview, you said you could not only help with my neuropathy, but you could help with my back, which was injured back in 2010 in my 30th year of teaching kindergarten. My L4 and L5 are bad. I've been told I could have back surgery, but I'm never getting another surgery. Because my knee surgery that I had 3 years ago doesn't allow me to play tennis anymore, or it didn't, I do now. But being down here for 6 weeks, doing everything you say to do and doing my nutrition and my exercises, I'm a good patient.
Yeah.
I'm a teacher. You're a good teacher. And I did everything I was supposed to for 6 weeks. I got well in 6 weeks, and when I went back February 26th, just this year, I went to play tennis the next night, and I played for an hour and a half.
Oh, good for you.
Oh,
That's
and
awesome.
I do golf on Wednesday nights, tennis,
Yeah.
no, golf is Thursday nights. Tennis is Wednesday night,
Right.
golf is Thursday night, volleyball is Friday nights.
What is volleyball?
Volleyball is like volleyball in a racquetball court. My kids are wonderful, they're very good to me, but they can't get over how healthy I am. Nobody can get over how healthy I am.
So why do you think things have dramatically changed for you? What changed in your routine, like when you started here?
Well, I always loved sports, and I've been a tennis fan all my life, and I've played tennis since I was in, I took tennis at the UC, at the University of Cincinnati, but I could not play tennis anymore because I had a knee replacement 3 years ago, and the knee replacement does not do but as good as it was before it went bad, but I blew it out at a tennis clinic when I was 69, and I hadn't played tennis for 3 years. I still go and watch, but I can't play. So my goal with getting down here for January and February, because that's all I stay down here at our condo, was to get healthy and be able to play tennis. And I did everything you said to do. I did my exercises morning and night. I did my supplements morning and night. I came here twice a week to the office visits, because it was supposed to be a 12-week program, but I was only going to be for 6, so I did it twice a week. Once we did it for the knees and once for the feet, because I had bad knees, bad neuropathy, bad back, varicose veins. I wear glasses, hearing aids, you name it, I got it.
And now, how's that changed though? What are you doing now?
Everything. I can do anything. They call me Wonder Woman. It's wonderful, but I think for Halloween I'm going to go as Linda Carter at first, and then I'll change to Wonder Woman.
Yeah, I did see the new Wonder Woman. That's good.
Yeah, but I can do everything and anything, and my memory is fantastic. I can remember back so long ago. People say, "My God, how can you remember that stuff?" I said, go to Dr. Davis, you know? You get help for your brain, you get help for your knees, your feet, your back, everything. And I did it in 6 weeks, and you can too.
Bottom line is that if we do the same things over and over again, we're going to keep getting the same results. We have a saying in our clinic, if nothing changes, then nothing changes. This applies to both patient and doctors. The conventional approach to treating peripheral neuropathy goes like this: prescribe medication, wait until the condition gets worse. Then maybe increase the dosage, wait until the condition gets worse. Then maybe add some more medication, wait until the condition gets worse. And then pretty soon you have to add in the really heavy-duty pain medication. This goes on and on until the patient is completely debilitated, and as a last resort, you have amputation. So there are 31 pairs of nerves running from the base of your skull, running all the way down your spine to almost to the tip of your tailbone. Each one of those nerves, if it's running down your arm to your hand, or it's running all the way down from your low back to your feet, each one of those nerves has 9 different fibers just like this. So only 2 of those fibers, about 20% of your nervous system, are sending signals of pain. And we know that they're firing because you have pain in your feet.
Those are working.
Exactly. But if we only focus on those 2 nerves, that's only about 20% of your nervous system. We want to make sure that we address what's going on over here, which is about 80% of your nervous system left over. So on this side, you have nerves that have to do with sending signals that are going to change the diameter of the blood vessels. So they're either going to vasodilate or vasoconstrict, one or the other. Get more blood to the area or less blood to the area. We also know that these are failing because of the temperature change from what's happening up here in your hands and your feet, how much lower it is in your feet. So you're not getting proper blood flow getting all the way down to your lower extremity. So we know these are failing. These fibers over here, these represent, so these are autonomic fibers, small diameter pain fibers, and these 4 right here, these represent the nerves, the large diameter fibers that are going to create muscle tone, right? Either a muscle is going to strengthen or it's going to lengthen. And then this last one has to do with light touch and balance. These 5 large diameter afferent fibers, these are the inhibitors for someone with chronic pain. So if these are failing, then it's necessarily going to not be stopping the pain. So I want you to think about it this way. You have a chronic pain condition right now. It hasn't been going on, you didn't stub your toe. It's been going on for months and even years in your case. So that means that we're going to use an analogy. It's like a car rolling. So that car rolling is your chronic pain in your feet. Okay? It's your chronic neuropathy that you have in your feet. That car keeps rolling and rolling and rolling. If you look at the car, you don't see anybody in the driver's seat. There's nobody in the driver's seat putting their foot on the pedal. Okay? The reason why it's rolling, that chronic pain is rolling and rolling. You might try an elixir here, some type of therapy, but it just keeps, it's pretty steady. It's always there. The reason why is because the brakes are broken, and these are the brakes. So that's what we need to do. We need to fix the brakes, and when we fix the brakes, it stops the pain signal. Rather than putting on our focus on the pain fibers here, which is, you can walk in a pharmacy and what do you see? You see an aisle of pain relievers, okay? But if we just focus on the pain, just the blinky light, and we don't fix the brakes, we're not going to move the marker much on your chronic neuropathy. So that's what we're going to do. We're going to be looking to repair these fibers, because these, if you look at the plastic on the outside, let's say that represents the myelin sheath over the nerve that's insulating, that fat covering that insulating the nerve. We know that that is wearing down, okay, because of the symptoms that you have in your feet. So we need to repair that insulation for the nerve, and that in store is going to stop the chronic pain that you're having. Does that make sense?
Yes, it does.
Okay. So what we're going to do next is a sensory loss test. So we're going to compare everything to what we find on your cheek, the sensation on your cheek. We're going to start with cold sensation. So I'm just going to touch this to your cheek gently. This is what a 10 feels like as far as coldness. So that's as high as it goes. Turn your hands over for me. Comparing that to your cheek, comparing your hand to your cheek, what does that feel like?
A 10.
10? And if that's a 10 there, what does this feel like compared to your cheek?
A 6.
A 6. Okay, so we're going to put a 10 and a 6 for the left hand and the left foot. We're going to do the same thing on the right. Compare this to the 10 on your cheek.
It's a 10.
It's a 10, okay. And what would this be compared to your cheek?
A 6.
A 6. So a 10 and a 6 on the right hand and the right foot. Okay, we're going to go to a sharp sensation. So I'm just going to gently touch this to your cheek, just like that. You feel that?
Mm-hmm.
Okay, that's what a 10 feels like. If that was a 10, what is this?
A 10.
Okay, and what would this be compared to your cheek?
A 7.
A 7. So a 10, and a 7. Okay, let's go to the right side. Compared to your cheek, what does this feel like?
A 10.
Okay, and what would this be like compared to your cheek?
A 7.
So a 10 and a 7. Okay, we're going to move along to the microfilm, and this is just a light sensation. Okay, so I'm going to touch your hand I'm going to actually touch your left hand in 5 different places. I want you to close your eyes, and you only tell me when you feel something.
Yes. 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 Yes.
Okay, so you got all 5 on your left hand. We're going to do the same thing on your foot. I want you to just lift your feet up a second. Let your foot, just your toes come off there. Close your eyes. Only tell me when you feel something touch your skin.
Yes. Yes.
Okay, so you only got 2 of those. So I'm going to put down 2. Shoulder, and I am back with Joyce, and Joyce was kind enough to come on and give us an update about her treatment in the office and the results she's seen for her peripheral neuropathy. So if we can basically go over again what you were just talking about earlier, just give us your story. Give us an update of how you're feeling, the changes you've noticed, just your experience in the office.
Okay. Well, I got neuropathy from having chemotherapy from breast cancer, and I've had that now for about a year and a half. And I was told by my doctor, my oncologist, that there was nothing I could do about it. And then we saw an ad for Dr. Davis, and my husband said, well, what can it hurt? Let's go see. So we did, and we signed up, and we started our sessions. Now I've been coming almost every day since we've signed up, and I was able this weekend to walk the beach barefooted and in my shoes. I was able to actually feel the sand and crunch my toes in the wet sand, not the real hard stuff, but the damp sand. And when I go to put my slacks on, I don't almost trip because my toes will move as I slide my foot into my pant legs, where I really had a lot of trouble with that before. And I'm very faithful in doing what Dr. Davis tells me to do at home. I've only missed one of drinking my nutritional stuff.
Right, very important.
That was the only, and that was just last night, and I feel better all over, and it's good to be moving again. I mean, I get tired when I go for walks because I haven't been able to do that in a while, but I will get back to doing that, and it's just wonderful to feel better and not have my feet hurt.
Oh, that's fantastic. I'm very happy for you.
So am I.
So what would you tell somebody if they're suffering with peripheral neuropathy? It's a similar case. What advice would you give them as far as getting additional care besides what they're doing with their medical doctor? What would you tell them to do?
I would tell them to try this natural
Mm-hmm.
without medicine and operations, because it definitely helps. I mean, it's unbelievable. I couldn't feel hot and cold,
Right.
and we were sitting out in the sun, and I just put my foot on my husband's knee, and I said,
Yes,
boy,
that's
are you
right.
warm.
Right.
I would never have felt
Uh-huh.
that before.
Right.
And just little things like that. I mean, you can tell they're coming back.
Mhm.
I mean, you're
Right.
silly not to try to make yourself better, because God made us to heal ourselves, and this
Mhm.
helps.
Oh, I'm Dr. Rob Davis with Active Health, Brain and Body, and I am here with Rick. Rick is one of our patients that came in the office. I think it's been going a couple months now.
December.
Yeah, it's back in December. And he was kind enough to come on and just tell us his experience from when he first came in here, the reason why he came into the office, and then his experience so far. So Rick, if you could just tell everybody why did you come into my office? How did you find me? And why did you come into the office?
So basically, I started having pain all over my body a year ago in February.
Right.
And so I had neck pain, shoulder pain, upper back pain, lower back pain, buttocks pain, tingling in my legs, tingling in my feet, and tingling in my arms and hands. And I went through all kinds of different treatments with a neurosurgeon, physical therapy, chiropractic, acupuncture, pain management. And I found you just popped up in either on Google or in one of my emails one time.
Okay.
And so I did a little bit of research, and I said, well, this sounds like something that I could take a shot at.
Mm-hmm.
So I came up here in December, and you gave me a test and an evaluation, and then you had me back after everything was processed to give me a proposal and tell me what kind of treatment you recommended over a 9-month period of time.
Mm-hmm.
And then you had me do a full set of blood tests.
Right.
And then you had me come in about 30 days later, and you recommended the diet, the PhD diet,
Mm-hmm.
and the continuing treatment that I should be going through
Right.
for the 9 months starting from December to 9 months from then. And so since then, I've lost 43 pounds.
Right on.
My neck pain is negligible. My shoulder pain doesn't exist anymore.
Awesome.
My upper back pain comes and goes a little bit. My low back pain is very infrequent. And my buttocks pain is pretty much gone away. My tingling in my arms and hands are gone.
Awesome.
My tingling in my leg is intermittent, and the only place I really have tingling right now is in my feet, and that's nowhere near as bad as it was when I first came here.
Good.
Now, when I first came here and they had me walk up and down the stairs outside,
That's right.
and they interviewed me, I could barely walk up and down those stairs without just hanging onto that railing for as much as I could just to get up and down. Now I can walk up and down those stairs like almost like a gazelle.
That's fantastic.
Yeah, so it, I mean, just in a very short period of time. What are we talking about? 5 months, 6 months now?
Yeah. Yeah.
I'm saying I'm like not like my pain level. All my pain level is about 1, whereas
Okay,
when I
that's
first
great.
came in here it was 5+, and so I'm really on the right path to recovery.
It's Dr. Robert Davis with Active Health Knee and Shoulder and Neuropathy Solutions here in Fort Myers, Florida. And we are here with Joe, and Joe was kind enough to come on. Joe originally came in with neuropathy a number of months ago. Give him a recap, and we've talked about this a bunch, just a recap of where you were when you first came in, kind of your experience in the office, and then where, what you were just telling me about, because we've seen some significant changes with you.
Well, last year I was referred to Active Health by a friend. I spoke to him about the problems that I was having with my legs and neuropathy. He referred me over here to Active Health, and I started here and really was doing great. Then other medical issues came into light where I had to stop coming here because I was so involved with the other issues. Well, slowly those were all taken care of. Well, you can't say all, but were taken care of, and I was once again having problems with my feet. So I decided to talk to the wife and come back to Active Health. And probably when I came in here, I was dragging.
Yeah. You're in the hospital for a bit?
I was in the hospital, had a bypass, and just doing horrible to the point where other people would help me do things.
Yeah.
And actually walking, I would be using a walker. So I definitely needed to come back. And at this point here, I think I've had 10 visits. And everybody has noticed the difference. And I have too. I can do things I wasn't able to before, and totally committed, and I feel wonderful. 90% better. Than
You
when I
got your
first
sparkle
came.
back, right, Joe? You got your sparkle back.
We'll be at 100% when we get up there, right?
Correct.
So what have you noticed differently? Because when you first came in here, you had the neuropathy symptoms, your numbness, some prickling feel. Like, what type of symptoms were you having when you originally got here? And what changes have you noticed right now as far as the symptoms you were having?
From the knees down, and especially in my feet, the numbness, the pain when I walked, it would grip, tighten up, my feet would swell up and just almost like bricks.
Right.
And now, towards the end of the day, if I do a lot of walking, I feel them swelling up, going really, really numb. Then after I lay down and get back up the next day, they're pretty much back to normal. And I'm out running around and starting the whole routine over again.
Right.
So,
What did you do before? What have you tried before you came in here? Like, did you go to any other medical doctors?
I went to a knee surgeon. I was
Right.
having problems with the knee. I went to a vascular surgeon. Ended up getting a bypass in this leg. I probably need another bypass in this leg, but not. It seems to have really subsided.
Yeah.
So, yeah, I know eventually, well, they monitor me every 6 months now.
Well, what we do, the reason why we can help people with neuropathy, because we help with vasodilation, so we help the vascular system.
Yes.
So when your cells are healthy, they're getting plenty of oxygen and blood and nutrition is flowing through the vascular system, getting to those areas of your body.
And I think the
Yeah.
oxygen therapy really puts a kick into
Right.
it.
So we,
And,
yep, absolutely. We have all the puzzle pieces. You know, I did this years ago. I remember Becky and I worked together, and I only knew so much about helping people with neuropathy, and we only had a couple puzzle pieces. We were still helping people, but I kind of stepped back from that because I'm like, I wasn't giving people the results that they were looking for, and then started doing my research, started meeting with some doctors online, and they had the puzzle pieces, so we just started putting them together,
Sure.
and we're getting results like what you're experiencing, and it's a real blessing to be able to do that. So thanks for sharing.
So, Joe, how do you feel about working outside your insurance company?
Pardon? Luckily, I'm able to do that, and it doesn't bother me at all. You know, it's the results that are important. The wife sees it, the friends see it, so it's a no-brainer,
It's priceless.
priceless.
Yeah, that's a good point, Becky. The problem that we have is that we have a sick care model, a crisis care model that suppresses symptoms, and it's very good at that. And God, you know, if either one of us have a heart attack, you don't come to me. Go to the emergency room, find a cardiologist, and have them fix you up, save your life. But after that, you know, you don't want to be on a handful of pills for the rest of your life. Same thing with the neuropathy. They're just throwing anti-seizure medication, things that are masking the problem. And that's what our system is good at, masking, covering up, suppressing symptoms, but never getting to the cause of the problem and removing the interference. So that's the difference. Insurance pays for the suppression through chemicals and pharmacology, but it doesn't pay for these natural solutions. And primarily, there's not really much money in helping people naturally. And that machine is already built up. So it's unfortunate, but that's where we're at. It's a sick care model, and the only way that system keeps working is if you got sick people coming through that funnel or through those doors every day. So we're doing things a bit differently here. So thank you, Joe. Thanks again.
Totally committed.
Welcome to the family, Joe.